AD World Health was created literally to deal with the issue of the global healthcare crisis, and especially sustainability when it comes to clinics around the world. There are many organizations that go to other countries, even in the United States, where they do these short mini clinics, which I call Band-Aid care. And those are wonderful and they're appreciated, but what do they leave behind them? Nothing. They leave a void. And our whole focus is to make sure that we don't leave a void behind, that we actually want to build sustainable clinics, partner with the communities, listen to their needs, not come in and supplant what they have been doing all their lives and tell them it's not worth anything, but instead to support them, uplift them, give them the information they need to focus on health, hygiene, education, developing community-based programs, and elevating those that live there. It's all about making a partnership that we understand and respect their community, but we want to help them to be healthy, to be well, and to prosper. And our whole goal is to really give them all of the tools they need and to stay with them as long as they need us, that we don't back out, that we build these wonderful sustainable clinics, these education centers, and they will decide when they no longer need our help. At AD World Health, our whole focus is on building sustainable free clinics around the world to support the communities in a way that is completely understandable from their aspects of reality. We want to make sure that we don't supplant their ideas, their culture, their language. We want to work with them, not put our own ideologies on top of them. The fact is that the only way we can make change is by making healthcare accessible to everyone around the world, even here, right here in the United States, in your backyard, is by getting your support. We need money to help us to do this work. And it's only through collaboration that we've gotten as far as we have, and it's only through collaboration that we're going to be able to continue to do the work we do. We want to have clinics and accessibility to healthcare everywhere in the world. And if we partner with you and all of the other organizations that we have, other non-governmental organizations and nonprofits, when we come together as a collaborative effort, we have the capability to heal our world and to care for each other. But that's only possible with your help. There are several things that make AD World Health successful. First of all, it's really partnering with the community we work with, asking them, what do you need and what do you want, rather than supplanting their ideas of what their culture is about with our own. By asking them what they need in their community, we're able to understand their culture, their ethnicity, even their language, and be able to partner in a way that we feel is so meaningful. It makes it a two-way street because in the process of helping that community to heal, to learn about health and hygiene, we also learn about them ourselves. We learn about the heart and soul of those communities. And we come away richer human beings for knowing them. Additionally, we also recognize that there has to be sustainability, which means the future. And the future for healthcare practitioners is the next generation of doctors, nurses, dentists, all of these healthcare providers. And that's something that we've really made sure is a huge focus for us, that we take that generation as students and uplift them, bring them with us as we travel so that they get to learn service firsthand, what it means, what it feels like to care for another human being. They will carry that torch forward for us, for a community, on and on and on for our future, so that it is truly sustainable. What makes AD World Health truly effective is that we really understand what it means to be a volunteer healthcare provider. All of our providers that work with us, no matter what subspecialty they're in, volunteer all of their time. These are people who are taking time out of their daily schedule to travel with us around the world or here in the United States, who are not paid to do this work, but recognize that if anything, they're getting paid back. The return that we get is more than tenfold. It is immeasurable what kind of gratitude and satisfaction that we get from helping other people. That's what's so important about sharing and caring for other humans. As we move forward in our work, we're very fiscally responsible. The fact that we look at every single dollar and see how we can stretch it, partnering with other organizations like Direct Relief International, getting donated medical supplies, medical goods whenever possible, doing things at the local level so that it's a lot less expensive, if at all humanly possible. We can make every dollar stretch because we need our donors to understand that we do appreciate every single cent and dollar they give us and that it's being used as effectively as humanly possible. That's what makes it work for all of us to be able to partner and collaborate with these other organizations. At AD World Health, we have several metrics of success. I think that the most important ones are the fact that you can look at the work we've done and what are the actual outcomes. A good example would be vaccinations. When you vaccinate an entire group of children, especially at an orphanage, then even as new children come in, they're not perpetuating disease. So you know that you're making a difference when you've vaccinated for typhoid, measles, mumps, rubella, and the incidence of those diseases are less not only in the orphanage population, the children's population, but also the community at large. Those are trackable metrics and very, very important. And because as we work with clinics, whether they're free clinics or stable clinics around the world, they all track this information, so we're able to track it over several years to see, are we making the impact we believe we're making? And that is the most important piece of all of it. The goal is always to make sure that you're not just thinking you're doing the work, but that you have proof that you're doing the work, and that the outcomes show that all this hard work is paying off and making a difference in the community. The other one is a really big one. Is the community happy with the work you're doing? That's a very big piece of the metric. Are they asking you to come back, that they're happy that you're traveling back to their area? They feel that you're making a difference. That's one of the most important and I think the most rewarding metrics that we can possibly track. There are a few things about AD World Health that are often misinterpreted. I think the first would be that we only work internationally, that we only work in other countries. But to us, we're a global organization, which includes working in the United States. We have a lot of programs that we run and work with right here in the United States, in your backyard, in our backyard. One good example would be Care Harbor. Partnering with them to do these huge, big free clinics once a year. It's right here because we have a tremendous need right here in the United States, not just everywhere else in the world. The other misinterpretation is that people will say to us, well, if you're going to work in the U.S., then why are you working anyplace else in the world? Why are you international as well as here in the United States? Because we're a global organization. We need to care for our whole community because our whole community is in need. Again, we don't really feel that there's borders. We need to make sure that wherever healthcare is missing, our job is to bring that. And that's probably the third misinterpretation, which is that we only do healthcare. Sustainability is not just about bringing doctors to an area for a short amount of time. It's about building sustainable infrastructure, and that's what clinics are. Our focus is on building those clinics and bringing all of the support that needs to come from the community as well as from outside the community, partnering together. At AD World Health, we have several wonderful accomplishments that we're very proud of. The first would be getting the clinic at Tawang, India, at the Manjushri Orphanage opened. That was back in 2007 and 2008. With the support of Direct Relief International, who donated $89,000 worth of medical supplies, shipped it to India for us for free. Then we had to figure out how to get it up the mountain. The nearest airport's a 2.5-day drive from a city called Guwahati. So the local community helped us get it from the port to Guwahati, and from there the Indian Army took all the supplies up the mountain for us so that we could get everything up there to the clinic. This is an example of how collaboration works. To see that when we first started, the children were so ill, and to see that as we brought vaccinations to these children for measles, mumps, rubella, typhoid, and even tuberculosis, to see these diseases significantly decrease in their incidence, to see these children thrive and be healthy, and now to see these kids since 2007 to today with 2 of them in college, one for engineering and the other one going to nursing school, who plans to come back to be our nurse at the clinic when she's done with graduation. You can't be more satisfied and more proud as if you were a parent to see how these children can thrive if they're given all the tools they need. Another really big accomplishment for us has been our partnership with Care Harbor, running these free clinics that run 3 to 7 days in Los Angeles, caring for nearly 1,000 patients a day, doing free medical, dental, and vision. We've been running the medical side of this since 2008 and showing that it makes a difference. Not just doing the care on the days that they're there, but the fact that we've partnered with other organizations that are there on site. 30 to 50 different community clinic associations that are actually there making follow-up appointments for these patients before they leave. We find a new diabetic, we find a new hypertensive patient. They have an appointment in a clinic. Whether they have health insurance or not, they have follow-up care. They have a medical home. At AD World Health, we definitely had a significant challenge in that we started our organization in 2007, and then there was a global financial crisis that hit in 2008. And fundraising was very, very difficult. But out of it came something very amazing, which is that despite the fact that people were struggling, they still recognized what it meant to care for somebody who had even less than they did. So out of a hardship, we learned something very, very beautiful and very inspiring. From there, certainly the challenges just have been growing and building as the entire world has grown and built back out of this financial crisis. It's been a challenge, but an amazing experience to work through. If AD World Health had additional resources, there's so much we could do. It starts off with obviously building more clinics, but partnering more with the community, especially the youth. If we could be able to reach out more to schools, after-school programs, teaching health and hygiene, that then involves the families because it starts with the children. That's a huge piece of what we want to be able to do and make sure they have access to health care as they grow and as they start their own families. We also want to be able to partner more with other organizations like hospitals, medical residency training programs, dental schools. We need to be able to train the next generation of healthcare providers even more in service, right where they are, right where their training is happening. It doesn't have to be in India. It can be right here in the United States. We have these organizations that are actually getting funding from the government. They should be caring for our most vulnerable populations right here and right now. We feel that there are several gaps that AD World Health could fill that we currently are not able to do to the level we really want to without more funds to do the job. It comes down to more collaboration. With additional funds, we would be able to expand our use of telemedicine, which is using the internet, satellite connections to be able to virtually see a patient anywhere in the world. It's amazing that we're able to use technology such as an iPhone to take a picture of a patient's eye and be able to send that retinal picture to an ophthalmologist half the way around the world. We have the capability, but only funds allow us to extend even farther our reach to care for more of the world.